I have, I guess I've done it twice. Third time makes it a habit. Got a little presentation on the current status of COVID in and around our area, so I'm going to have Joseph run that with thanks as always to Horace Jamal, who actually puts this together and keeps it current for me. Bear with us just 1 minute if you don't mind. And again, with the disclaimer that there is a lifetime of data and statistics out there if you want to look at them. This is not meant to be comprehensive, but at least give some highlights and flavor of where we're headed. You got your finger on the button, Joseph? You can move it to the next slide whenever you're ready. All right, so the chart on the left is just the cases per day ever since March 1st, and you can see where we are now. I was just making the point that to the right of that last vertical line is real data, but subject to being added to as new cases come in, and they're allocated to the date when they actually occurred, for lack of a better word. So all to say, we're still headed very much in the right direction. We're higher than we want to be, obviously, but headed in the right direction. The chart on the right, a big chunk of it's covered up, and I asked Horace to do this. You see the little circle way out on the right-hand side is today's data. That was the percent positive as of today, and that line that runs all the way back to May 28th is day by day and a 7-day average of positivity rate. So this is one that gives me a little bit of heartburn. It's good. We're trending way down, lower than we've been in a long time. They've got this red, yellow, and green zone that helps determine what kind of policies we should, or at least policy recommendations we should be following. And so we're in this yellow zone between 5% and 10% positivity. So down is good, trending down is good, we're heading in the right direction. It's not much good for comparison to other states and other places because everybody's testing pool consists of different people, differently motivated. And so we can't compare this to Alabama or North Carolina because in those states, who gets tested and why and what are the requirements to get there are very different. So suffice to say, we'd much rather be in the yellow zone than the red zone. We'd much rather be trending down than up. That's going in a very good direction. Go ahead. These two, I've shown you before, these are two different measures of the same thing. They call it a retransmission rate. Basically, a rate of 1 means that in round numbers, for every person who is infected, they're transmitting it to one other person. So a number less than 1 means spread is slowing. A number more than 1 means it's increasing. And you can see that by both of these, we've been right at or just slightly under 1 for some time. This also has more meaning if you have a very high rate of positivity and a high rate of retransmission, or low rates of both. But it's a good sign. We'd like to get it under 1 and keep it there, and farther below 1 the better, but okay is okay for the time being while we're shrinking in the number of cases and rate of positivity. These two to me are very important and maybe the most important of what we see. The chart on the left shows on any given day how many people are in the hospital being treated for COVID. And again, the little box there that's given today's numbers is kind of covering up, but if you see all the way out to the left, that's April the 8th. And you can see what happened. It was fairly level to slightly up, then we took a big dip, and then we had a big spike that corresponds with the spike in the cases that we saw earlier and so forth. But this is what flattening the curve is and was all about. This is why we sheltered in place and closed businesses and a whole variety of things, because if spread gets out of hand and hospitals can't handle those who are ill, that's the big problem. That's what flattening the curve is about. And so you can see we are now well below even where we were when we sheltered in place and approaching even the good numbers that we had after shelter in place. The chart on the right is day by day how many new hospital cases are reported. And again, you can see the spike there back in the summertime that corresponds with the cases. But really important is the two horizontal lines here that show you where we are relative to our history. And in terms of new hospital cases by day in the state of Georgia, we're now below every previous peak, and we're very close to the bottoms all the way back to the end of March. This is very good news, very good sign. It's good not only because we don't have that great number of people being treated and taking up hospital space, it's also good for the hospitals who need to do all the other things that hospitals are there to do. And so their capacity, both in facilities and in human resources, are not being strained in a way that jeopardizes public health. So that's a very good number there. Do we have one more, or is that the end? Oh yeah, DeKalb County. So this is some similar information just specific to DeKalb County. On the left, again, you can see the enormous spike that we had during the summertime, the decline since then, where we are relative, if you look back, even to when we sheltered in place, when we came out of shelter in place, when we had a long, pretty flat average for a month or more after we came out of shelter in place, we're back down around those levels. Lots of speculation, lots of possibilities about why all this is, but masks help. And people being careful, social distance, learning to live with the thing while we get our work and other responsibilities handled is working, and that's where we need to be. No time to let our foot off the gas. On the bottom right, that's just a day-by-day chart for DeKalb County that also shows the cumulative cases. So that solid red line will go up forever as long as we have one new case, but you can see that it's flattening significantly, especially relative to summertime and the low number of cases that we're having in DeKalb County right now. One I'll point out that isn't really clear from this chart is that colorful state of Georgia there in top center. That's a graphic from the Department of Public Health website where you can click on there on any county and see lots of data about that county. The key one that you would see here, if we could click on it, would tell you how many cases per 100,000 residents we've had in DeKalb County any given day. And the significance there is that we dropped below 100 per 100,000 a week or more ago, and we stayed there for some days. The latest I've seen is it's gone slightly back above 100. So we're talking about 96 cases per 100,000 residents, or 104 cases per 100,000 residents. The important thing about that is that there are certain decisions, particularly significantly return to school policies, that are triggered by that threshold one direction or the other. And I can't tell you sitting here tonight what the current state of that is, but that 100 cases per 100,000 residents is a significant number, and we're bouncing just on both sides of it over the last couple of weeks. So that's one where we can have a direct impact by doing the right thing, keeping ourselves safe and out of harm's way, protecting especially the vulnerable. That's one that's going to make a significant difference in the way we live our lives each day. I think that's it. I just want to say this is a hard thing to talk about because you'll get misquoted, you'll get misconstrued. Basically, these numbers are all good. They're all headed in the right direction. We need to do more. We need to stomp the thing out. But I'll say that when you see that our numbers of cases are similar to where they were in March and April and May, when you see that hospitalizations are even less than they were during those scariest of times when we didn't know as much about what we're dealing with, you see that people are managing to get to work, the city's managing to do events, properly distanced, and all those things. We're learning to live with this, and we're learning to protect ourselves from it while we do it. This week, you might have seen the World Health Organization, who actually has certified Tucker as a lifelong and age-friendly city. Also, this week said explicitly that lockdowns should not be the primary means for containing this disease. It's a last resort. It's a means to protect the healthcare system and other public facilities, as it were, but it is not the primary means. And so I think we're starting to figure some of that out. We're starting to figure out that we can do both. It takes a lot of cooperation. It takes a lot of good information being disseminated to us and to the public, and for people to kind of latch on to that and learn what to do. We're seeing surveillance rates where they just test what amounts to random groups of unsymptomatic, asymptomatic people. We're seeing positivity rates of 1% and 2% where those things are done in a real clean statistical way. So lots of good news. Long way from over. We're going to be wearing masks for a long time. Stick with it. Keep working at it. Don't let down your guard. Protect the ones around you who are especially vulnerable to a severe result if they do get it. And carry on. So good stuff. Good for us, for DeKalb, for the state of Georgia. Things moving in the right direction.